as a participant. If you can move her to
Oh,
show
good.
as presenter.
Great.
So
Good job.
Catherine, Karen, and Lisa.
Great.
Perfect. All right, so let's formally begin. Everybody
Conference
okay with that?
recording started.
This is Boris Collins from Hospital Quality Institute, and I'm welcoming you to Engage Track 2 webinar on the title of Family Engagement from the Family Point of View. This is our last webinar in the series, and as you know, Track 2 is where we focused on engaging patients and families as partners in safety and quality of care. We've covered topics such as family engagement to help prevent blood clots, ventilator pneumonia, prevent readmissions, medication error, infections, falls, surgical, ensure surgical outcomes with success, and so on. And today, the topic is especially compelling, and we're grateful to our patients and families who have generously agreed to share their stories with us. There's nothing quite like learning straight from the source and shining the spotlight on real engagement practices and tools, or lack thereof, that people have experienced in their own lives. We have 3 speakers today whom Karen will be introducing in just a moment. There are a few people attending the webinar live, and many more will take advantage of the recording, which we'll make accessible from our website at HQI, and we'll promote it in various ways as a really valuable learning opportunity for people to do on their own time. So quick logistical information about the webinar. We are recording it, as I said, for future reference. All our lines will be unmuted, and so please mute your own line if you need to. Use chat function to ask questions or make comments, or simply speak up on the phone. We are a small enough group that we can do that. As every time, we want to make sure that we know who all is in attendance. So if you have anyone else with you who is attending, whose name is not showing up as logged in, if you could please type their name into the chat box, that would be appreciated. And I'm seeing the slides kind of wildly moving around.
Oh, I'm moving them, and I will hold still if you're moving them.
That's okay. I'm like, wow, am I dreaming? Did I advance that fast?
You're being wild.
So here you can see some of the topics that I mentioned, and just to mention, our program has been parallel to CalHEN 2.0, or our hospital engagement network here in California, with over 180 hospitals participating over the past year to reduce harm on all these topics that you see on your screen, and those with the arrows we have aligned with directly with shining a light on family engagement as a method of supporting success. And then here are the learning objectives. You can hear from patient care partners on how family engagement practices have impacted their loved ones' care and recovery, and you can apply these experiences to the models and practices that we have discussed over the course of the Engage series. And here you can see our friendly faces from Partner Health, Karen and Mary, from Hospital Quality Institute, me, Boris, and Shweta. And I will keep it short and sweet and let you begin, Karen, if you're on.
Oh, yes, I am. Thank you, Boris.
Karen, you're coming pretty faintly. Can you make it louder somehow?
I'm giving her driving instructions on my computer, so she's now ready to advance slides.
Okay.
Oh, I thought you guys were already driving to Napa.
No.
You're just driving the computer.
She's used to a Mac. I've got the Dell.
Yeah.
Okay.
So our guest contributors today are 3 people, Lisa Mears, Karen Caton, and Catherine Dodd, all of whom will share their stories of being family member care partners. So I don't want to take anything away from them except to describe that all of them took very seriously this conventional wisdom that it's really important to bring someone with you to help safeguard your care. And in all three cases, they were care partners or patients themselves in the case of Catherine on multiple occasions and learned some very valuable lessons and picked up some really great skills for being a proactive care partner to the people that they care about. In particular, the lessons that they learned and they're going to share with you today are those kinds of practices that families can engage in to prevent the most common and preventable hospital-acquired harms, which we lump together as never events. And of course, one of the never events is a preventable readmission as well. So with that, I hearken back to our old friend Albert Einstein, whom we refer to. He's sort of the mascot for this series, is that we know we have problems, and we're all so together on this webinar series intent on learning new ways to think about these old problems. And their perspectives will certainly help us think in new ways. So, and fundamentally, the new way that we have been thinking about for the last 8 sessions is how do we form positive collaborations with our family members to support patient safety and prevent readmissions. It all involves, as we said, active listening to a whole host of different stakeholders in the care process. So with that, I'd like to introduce Lisa Mears, who is dialing in from her desk at Annixter in Chicago, and ask her to talk about her experience as a care partner to her husband, Robert.
Great. All set?
Thank you, Lisa.
Okay. Thanks, Karen. Everybody can hear me clearly?
Yes.
Great. So thank you for inviting me to share my story with you. I'm thrilled to be able to share it and to share my experience with the checklist and the partner health tools, which truly are, you know, I've had the privilege of seeing them develop, and they just get better and better and better. Unfortunately, I've had a little bit of experience with hospital stays, and you know, I think like so often happens, it somehow comes out of the blue. Now, they never totally come out of the blue, but you know, in my situation, my husband, who played a lot of golf, happened to have a moment where everything came to a complete collapse, as it were, and he collapsed while he was playing golf. And the next thing I knew, you know, I got a call saying he was in the ICU, and he was diagnosed with a whole series of different complications that probably existed for many, many years, possibly decades, but had never been formally diagnosed. And they included heart issues, they included diabetes, they included vision issues, ultimately infections. So he had basically, you know, a very complicated medical situation. And when his health was improved enough to have surgery, he went in for a triple bypass, and it resulted in actually having a quintuple bypass. One of the real challenges for him was that as a diabetic, he didn't have great circulation, and he had an infection, and it was really challenging to get the infection controlled enough to actually have him have surgery. And obviously, they actually never eradicated the infection, but they had it under control well enough that he could have the surgery. But of course, that was a huge risk post-surgery to make sure that you know, he didn't get infections, because he would not necessarily have the ability to fight the infection. So off we go to University of Chicago Medical Center for his bypass surgery, and in spite of sounding like I had a little bit of time, there really wasn't much time to prepare, and you don't really have any scope of what you're about to deal with. But fortunately, I did have the Partner Health tools and a dear friend in Karen who was just an absolutely critical resource for me. Some of the actions that I took basically that were informed for me through Partner Health were the layout of my house was such that I was able to have a one-story bedroom off of the kitchen, or it was a one-story room that I turned into a bedroom for Robert off of the kitchen, making it more convenient for him, more convenient for caregivers, easier, giving him some mobility, giving him the ability to do more for himself than he would have been able to do if he were certainly upstairs or in a different part of the home. That, thinking about things like that are things that, the daily living side of this really help you frame. Prescriptions are another major challenge. It's both a medical challenge and also an organizational challenge because you've got to figure out what he needs. You've got to work with all sorts of different doctors to make sure that they're working together, not independently. You've got to, do the logistics of getting them filled, picking them up, getting them administered, and that all sounds straightforward if you have a nurse or have somebody to help you, but of course I work full-time, so it actually was a lot of challenging logistics. And again, the tools from Partner Health really helped me understand what the issues are, importantly, and I mean, heck, you can't solve them until you understand them. So that was very, very valuable for me. And then there were clothing issues, which one of his challenges, again, with his whole host of problems and neuropathy and fine motor issues, and which make it difficult to eat neatly and make it difficult to button up clothing. So we were able to actually think through how to get him clothes that were more, I'm going to call them more accessible clothing, but clothing that, washable pullovers with like 3/4 zip so that he could get them on easily, he could zip them up easily. It's actually hard to zip up a zipper if you can neither see it nor have the fine motor to control it, and so that was a win to find clothing that would look neat and was able to easily wash, and he could get on and off and still look respectable. So those were all different examples of how the Partner Health checklist helped me, and I would say that it's in some ways like an Apple iPhone. It's intuitive, it's easy to use, it helps you think about things that you had not previously considered. It certainly gave me a way to make a plan for what to expect next. It allows the family, the entire family, to be able to contribute, which I think is really important in so many medical situations. The family feels helpless because, of course, they don't have the medical knowledge, but this gives you a tool that all family members can contribute and really have a sense of purpose in the recovery and the outcome of the health. And it hugely reduces the risk of readmission. I have to say that we were either lucky or maybe it was more than luck that we didn't have a readmission, that we didn't incur any more infections. And, I would certainly credit this, the Partner Health tool to, it doesn't get complete credit, but it gets a whole lot of credit because you never know what the whole set of circumstances that cause somebody to have a good outcome are. But he, I would say, was very, very fortunate to have the outcome he had given the set of risks he had going in. I think it's very complementary to the medical system, which, from an outsider's perspective is incredibly complicated. And, it allowed me to be a real partner in his medical treatment, in his, hopefully I was a partner in a successful outcome for him. And, of course, at the end of the day, it should lower costs for the whole system, and that makes you feel good. It should lower costs for yourself, which is practical. And most importantly, to me anyway, it's it's a really user-friendly tool that offers virtually unlimited upside, and as far as I can tell, there's absolutely no downside to it. So when you get an opportunity like that, it seems like it's a no-brainer to try to put it into practice and see if it really can help broadly people do better with their health outcomes and help the family help their loved ones. So that's my story. I hope that wasn't too long.
No, perfect. Thank you, Lisa.
I feel very chatty.
Yeah. No, actually, one of the things that you mentioned to me, too, when we were just talking about it, just having that little bit of information, and maybe I misunderstood it, but I thought just having that quiet time looking through information, that it gave you a better sense that it was okay to ask questions, so that you felt more comfortable just during his hospital stay.
Oh, yeah. And you do have so much downtime, and you have, I think, in addition to making you feel more comfortable asking questions, it helps you understand what questions to ask. And, I always like to say, you just don't even know what you don't know. And this helps you to, it just is a mind jogger to say, okay, these are the things that I actually really need to think about. And at the moment, you're really not focused on those things. So it's just invaluable in helping you focus on, what's next and what really matters. You're sitting there in the waiting room, and all you want is to have the doctor come out, and you're told it's going to be, 1 hour, and it's inevitably 3 hours. And so this is so valuable to have while you're waiting in surgery, or while you're waiting for somebody who is in surgery.
Karen, can we ask a question?
Yeah, go ahead.
Lisa, this is amazing and wonderful affirmation of the tools. Can you just give us a sense, did the hospital staff have interface with these tools? Did they actually promote them? Were they aware of them? Or did they exist sort of in a parallel universe of sorts for you?
Well, for me, it was more of a parallel universe, because this was earlier in the days of the tool, and it, in my experience, the nurses were great, but doctors you don't have, at least I didn't have a lot of interaction with, short of, the very professional description of, now we're done and this is what happened and this is what we saw, and, now we push you into different hands. And so it's a little bit, from a patient perspective, you don't have the doctors helping you so much. It's the nurses, and the nurses are great. And I'll tell you that my challenge with my nursing experience was that each day we would have a different set of nurses, and so you would have to work with somebody else. And there were different tools in my program that Karen provided for me that had ways to communicate with each shift. In my case, I swear there was only a different shift each, however many hours per day, but there was, a Monday shift, a Tuesday shift, a Wednesday shift. I mean, it was very rare, and my husband was in the hospital for a long time. It was, gosh, I think in the end it was about a 17-day stay, so it was quite a long time. And I think there were 17 different nurses that were involved. So the nurses were helpful, but it wasn't, it was a re-education process with many, many nurses along the way.
Mm-hmm.
And so, the ability to take notes and keep notes and communicate with each nurse, and, some, like any other population, some are really, really engaged and have a lot of great ideas, and some are just, okay, I'm checking, box A, B, and C, and then I'm on to my next patient. So it was, I would say, to use your word, it was more of a parallel universe.
Mm-hmm. Thanks, Lisa.
Okay.
Thank you. Now, Catherine Dodd has some great stories to add on to what Lisa just opened the door for.
Okay, can you
Thanks,
hear
Lisa.
me?
Mm-hmm.
So I was a inpatient 6 different times for about 6-day stays, and then for a 29-day stay. So I was first treated with heavy-duty chemo to clean out my bone marrow, and then was admitted for more chemo and a bone marrow transplant or stem cell transplant. And the importance of having someone there who took notes and after the initial diagnosis was essential, because there were lots of choices to be made and lots of questions to ask. And when you're the patient receiving it all, it's overwhelming. It's probably overwhelming for the loved one or caregiver as well, but it's especially overwhelming. You have selected hearing as the patient. So being able to leave a doctor's visit initially and then say, well, this is what I heard, these are the options, and have it written down is really important. And then the addition is to find out who to call and when you can call if you have questions about what you remember. So I made it through all 6 hospitalizations and then the 29-day hospitalization for the stem cell transplant. I think we went so far as to have my caregiver call in from a conference, so that we put the cell phone in the middle of the room and tried to make sure that there was consistency in terms of who was taking the notes and who had the questions. In contrast, I will say that I'm currently caring for my adopted mother who has stage 4 lung cancer, and I was able to go to her first oncology visit. I was not able to go to subsequent pulmonology visits. I went to one radiology oncology visit, but not the subsequent one where they broke her ribs as they were strapping her in. I went to the second opinion visit, but not to the subsequent primary oncology visit where he disagreed with what the second opinion said. And what that does for the patient is they're already confused. They're already, what should I do in terms of what are my real choices? But it doesn't give them a consistent person to bounce the information off of, because different people have been to different visits. I tried to write up my summary and send it out to other people who would be accompanying her to visits, but I think because I have a healthcare background, my notes were different than notes other people would take. She's trying to keep a notebook herself with all the information in it, but every doctor you go to, you get a new packet of information, and it's pretty overwhelming. And then on top of it, the American Cancer Society sends you a whole binder of information, which is probably helpful if we sat down and walked through it, but it's just too much information. So I think that the consistency in terms of who's saying what and who's hearing what, and clarifying it with the physician. I think nurses probably have an important role to play in terms of saying, confirming that patients and their caregivers heard correctly, and saying, if you have questions, this is where you can call. The generation of people, I think when I was a patient, we were not afraid to call because we were that generation of you ask questions. My adopted mother's generation is, well, I don't want to bother the doctor, or I'll see the doctor in a week, and meanwhile, things are progressing. So having a consistent note taker or person who's keeping track of what the different procedures and medications are is essential. And if not, having some way to catalog it is important. The other experience I also had with my adopted mother was after she broke her hip. And we had someone at the hospital. So this was just during the hospitalization 24/7. We had different people would take different shifts. And we had a notebook that everybody wrote in. You know, it was 7 o'clock in the morning, and the nurse came in. She doesn't have a fever. It was 9 o'clock. She has diarrhea. It was 10 o'clock. And that helped people go from shift to shift. We, of course, also had Safe and Sound in the hospital there for each caregiver to read and to know what questions to ask. And that worked, but it was for a very short period of time. So over the long haul, consistency, keep track of it, keep it in a notebook, and don't try to do it yourself. Have someone else do it for you.
Thank you, Catherine. This is Mary. So Karen and I were just saying, who's going to say the next thing? I think the point that you made as well, that a way to organize the notes, what's just happened, what is the person experiencing, what questions do I have? And Lisa said this as well. You're sitting there many times for many hours alone, you know, anticipating a physician visit or the nurse practitioner or the clinical nurse specialist. And, you know, you knew you needed to ask them something really critical, and you've got so much on your mind you may not recall it. So having a way to organize those questions, you know, separate from the daily events, really helps to keep the structure. And it also helps other people find the information when they may be coming in and you're handing over to them. Karen also has on the slide the image of a phone or a tape recorder, though most people have a phone that's capable of recording. And there are some settings that are beginning to introduce the recording of instructions and, for example, discharge instructions particularly. And it's always worth asking, you know, could I record this conversation so my sister can hear it later, or I can take notes from it later, because things do happen very quickly. And even writing, you may find yourself distracted from, you know, what's going on in the room. So thanks for being on today.
I'll also just add there's a website, carezone.com, which I think is more for the patient than it is for the family member, but it's a way for patients who are by themselves to keep, if they are capable, to keep track of symptoms, medications, and changes, and it's one I would recommend.
Oh, that's a great idea. I will look into that, because that's the other reason why I just put up this example of, you know, a laptop or an iPad or whatever, because I was hoping that there would be apps out there that people would know about, and just to show too that, you know, whatever your comfort level is, whether it's the old-fashioned paper or pen, or it's, you know, recording everything on your electronic device, or even just recording, you know, the conversation, any one of those things works. It's just important, as you say, to pick something that's consistent that you can share with others. And then also, as Mary said, try to set up some consistent categories so that there's, you know, there's a structure. There's a lot of miscellaneous information that comes up, but every day track those meds, track those tests, track your patient's goals, your loved one's goals count for a lot as well, just so that there's, you know, your situation I think is very common where it's one person alone can't help as much as they would like to. There's just life. So if you have that consistency and that method, you can share notes more easily.
And the CareZone does have private secure sharing, so that the caregivers could look at it. So, and it has an area for photos and files, so you could scan in lab results. It's pretty well put together.
Oh, thank you for bringing that up. I'll insert that link into the slide because it's going to be shared on the website and to other members of the hospital groups that are participating in this hen work. So thanks a lot.
Great.
Catherine,
Okay.
thank you. And we're going to...
Karen, can I ask Catherine a quick question too? This is Boris. Catherine, thank you so much for sharing. And I'll ask you a question along the lines of what I asked Lisa as well. And that is, how, in your experience, how could the hospital or hospitals that you interfaced with, how could they have supported Care Partner that you worked with, that supported you? How can they empower? How could they have empowered that person, perhaps more in being more effective, more confident, and not just the person, but also the tools? You said that the Safe and Sound were available for in each room and things like that. Any tips on what more could have been done by the hospital?
Well, Safe and Sound was available because I brought it into the room. So, I mean, I think Safe and Sound should be part of any planned hospitalization. So it should be in the physician's offices, you know, and you get it saying you're going to be admitted on Tuesday for a total knee, or you're going to be admitted. This obviously was an emergency. It was a hip replacement, but it was useful for the caregivers. The nurses didn't really have time to look at it. How could the hospital be more helpful? I think telling the patient and the caregiver what you're doing and why, and what to expect during the rest of the day. It's wonderful that there are whiteboards now that say, this is your nurse, this is your medical assistant, you know, these are your goals for the day. But, you know, what time are things happening? Do we have any idea? A lot of caregivers would like to be there. I think this was mentioned earlier when the doctor comes in. There's nothing that precludes hospitals from working with their hospitalists or with their specialists from saying, this is what time you're going to be on the 6th floor, so that people can have their caregivers there to hear exactly what the plans are. Because luckily it's not always, you know, it's not an individual decision. It's a decision you make with your family or your loved ones. So scheduling rounds is important. Scheduling.
I also would echo Catherine's point on Safe and Sound. That was a huge aid to me, and I would agree that that should be part of you know, any hospital stay. It's just, it makes it so much easier to track what is said. In your comment about selective memory, I mean, obviously for patients, it's incredibly difficult. I think even for, you know, a family, for a loved one, it's really difficult because, you know, it's a lot to process, and it's, you know, in many ways a new language. You're learning things you just had no idea of before, and it's confusing, and it's in medical language, not in your street language, and it's, you know, complicated names of procedures and diagnoses and medicines, and you're, you know, get asked questions to make very quick decisions, and you know, so the more tools you have in the simplicity of the tool is what to me makes it so incredibly useful. And you know, I go back to Safe and Sound really helped me to track what mattered and to listen, to be a better listener, and to ask better questions consequently.
Mm-hmm.
Well, both of you have given excellent intros to Karen. Karen,
thanks, ladies.
Yes, she is. I'll let Karen speak for herself. We have, oh, and Karen, the photo I had of you and your family slid off your slide. I have no idea how that happened. I'm
Oh,
sorry.
I'm so sad. It's such a great picture of my dad. That's all right, though. It's okay. No worries.
Yeah, oh dear. I'm sorry.
No problem. Don't worry about it. Don't worry about it. Do you just want me to go ahead and take it from
Yeah.
here?
If you wouldn't mind sharing, Karen's
Sure.
going to talk about her experience with her dad, and I had such a great picture of the two of them together, and I'm sorry it slipped off the page.
Oh, don't worry about it. Don't worry about it. Hi, everybody. My name is Karen Keaton Brunnings, and I am lucky to be part of a patient family advocacy council at Tahoe Forest Hospital in Lake Tahoe. I've been with the council for a year and a half, and I got to be a part of the council because of my dad, actually. My father was diagnosed with a very rare spinal tumor when I was a young girl. And that tumor, over the course of his life, had to be operated on 9 times. It kept coming back. They couldn't go in and get the entire tumor out because it was embedded in his actual spinal cord. And so he went through radiation and multiple surgeries and back reconstruction because of the scar tissue from these 9 surgeries. So my family, over the course of our life, was in and out of hospitals and radiology departments and doctor's appointments, dealing with my dad. It was a very different experience when I was a little girl, but as I grew up, I started feeling a little disenchanted with just the whole process of being in the hospital and feeling lost and like you ladies were talking about, just not knowing what questions to ask or who to trust or when the doctors were coming or when you should go get coffee or when you should leave or should I go to that appointment or not. It just, all of it was quite overwhelming for myself and my entire family. 2 years ago, actually, my father went in for his last surgery. And I was Facebooking pictures of myself in the hospital and being angry at all the signs of don't do this and you can't come in here and, just airing my frustrations about the hospital system and just wanting to be part of my dad's care and feeling closed out. And a friend of mine who was just beginning the Patient Family Advocacy Council at Tahoe Forest saw my pictures and saw my frustrations and said, you're never going to believe what I'm doing. I'm trying to get patients and families involved in the care of the people that are in our hospital. I know that doesn't at the moment help your dad, but would you be interested in sharing your ideas or your frustrations or anything? Can you come in and be a part of this? And I thought about it, and I was like, well, I'm a single mom. I don't have that much time. I've got this dad who's in the hospital and sick, and he's going to be now again in and out of rehab and with physical therapists and this and that. I was like, I don't know if I have the time to do it. That she kept on me, and I finally decided, okay, I'll do it. I decided to go ahead and do it because my dad actually died 6 months after that last surgery, and I was like, this is my chance to do what I couldn't do at my dad's hospital, in my dad's hospital system, and maybe make a difference in my town, in my hospital, so that families and patients don't have to feel lost when they're with their loved ones in the hospital trying to get questions answered and all of that. So I went in sort of with the idea that I wasn't going to be able to make very much of a difference, and thought, well, it could just be the hospital wants to have this council to make it just to have one of those things where I can say, well, we have a patient advocacy council at the hospital. I went in thinking we wouldn't be able to make any changes. The very first meeting we had, they talked a lot about, well, what are some things we can do to help our patients? And that over and over again, all of us that were on the council said, it's communication, communication, communication. It's got to be better. When your family's in the hospital, it needs to be better. And I think it was Catherine, were you just talking about the whiteboards? Yeah, well, we've got these whiteboards. We talked a lot about that. Like, well, let's get whiteboards. We don't have them at our hospital. And one of the things we said has to be part of that, those whiteboards, is when are rounds? What are the names? Have the names of the family members who are going to be in the hospital that are going to talk to the doctor, so the doctors know the names of your daughter and your wife or your husband. what's discharge information? What time am I going to be moving from this room to that room? What time am I going to be leaving the hospital if that's relevant? Nicknames, if you have a nickname, just information about the patients themselves that would help connect some of the dots between the doctors and the nurses. And so we talked a lot about it, and everybody kind of nodded their head and said, yeah, that's a great idea. And I thought, okay, well, let's see what happens. Then the very next month, went back to the meeting thinking, oh, it'll probably be a different project that we're working on. And the head nurse came in and said, we've got a prototype. We listened to everything that you said. What do you think? And they showed us these whiteboards and it had all of that kind of communication stuff that was so important to all of us because we'd all had those same experiences where there wasn't good communication and you're lost and you're not keeping track of what's happening and what's going on. And the whiteboards are now in our hospital and part of like the day-to-day operations. And every day it's helping the patients and the families that are struggling just to communicate with doctors and keep track of their health and their wellness. In addition to that, our council, just to kind of toot our horn a little bit, we've done a lot of other different stuff too, not just the communication piece with the patients and the families in the hospital when you're having issues, but we've done talked about an overhaul of the website, discussed the ER and extended care, like noise reduction in there to help it be quieter, and options and ideas to help like community outreach regarding the health and wellness programs that our hospital offers. Discussed the doctor's office and clinic appointment and telephone protocol. I mean, the list goes on and on and on about trying to make the hospital system more user-friendly, more comfortable for the patients and the families, and it's been an exciting and wonderful experience. Anybody have any questions?
Well, Karen, one thing I'd like to add is something that when we were talking that you really resonated with me is you said something about the fact that when you're in the hospital, before you go in, you're, confident, capable people, you plan your day, you plan your life, and then all of a sudden you're accustomed to being proactive and just, being in charge of your life. You go into the hospital and it's all about reaction. It's reaction, waiting for this, waiting for that. And the stress is really hard to manage. So just that knowing when the doctor is coming in, so you, as you said, then I can plan to get my lunch before that. You need your lunch. You need that, so you're not putting your own lunch on hold just thinking, I can't miss the doctor. I've got to see.
Yeah, I don't want to miss, or the physical therapist, or the occupational therapist, or the surgeon is going to come in and talk about how things are going. I mean, that piece, that communication piece, those whiteboards were so important for our hospital because I would have given anything to have anything like that in my dad's care. There was nothing like that. We were sort of at the mercy. We just felt like we were just like, okay, it's just going to be what it's going to be. This is what a hospital system is like, and you are at the mercy of that. And that with our patient family advocacy council is something that we've hung on to. Like, we don't want that to be the way it is. We want there to be communication. We want you to be able to get your coffee or know when the doctor's coming in or know when you're going to get discharged. And if there's changes, come in and change it. And our hospital has been doing a really good job of using the whiteboards and just trying to connect those dots.
And you also mentioned that there is understanding on your part. Say the nurse comes in and says, you know what, the doctor's been delayed by 30 minutes and then updates the information on the whiteboard, you can understand that. It's just the not knowing. And
we did talk about that. Like that's the worst piece where you're like, okay, well, they said the doctor was going to come in this afternoon, but what does that mean? And then when they don't show up because there's an emergency, there's no communication. You're just sitting there like, okay, well, I guess we're stuck. And our hospital has used the whiteboards as a method and a tool to be able to come in and change it and write it down. Not only tell the patient, but write it down and say, all right, this is what's happening, this is why, and it's all it is really amounts to is just communicating between the doctors, the nurses, the patients, and their families. It really is that simple, and for our hospital, it's been helpful having the whiteboard.
Mm-hmm. Yeah, all such simple solutions and so obvious, to patients and families, but to bring it up to care providers who have so much on their minds is really just wonderful for you to share this. Thank you so much.
You're so very welcome.
So Mary's going to take over now and guide a sort of a freewheeling discussion here among everyone.
Well, I want to thank Lisa, Catherine, and Karen, and I think as Boris started the conversation at the beginning of the hour, hearing firsthand is really the most effective way for those of us in healthcare delivery and education to learn how we can do this work better and how we can better partner. So it's been very gratifying to hear your stories, and actually it sounds like there are opportunities for improvement, but there was some process improvement and some positive things that took place in each of those stories at the outcome. And so I'm very pleased to really just pose to those of you that are still on the line, we thank you for joining this call and for being part of the Hospital Engagement Network, the Engage Track 2. As Boris might mention at the end of this, we have a big event tomorrow, the big capstone of this whole project, the 1 and 2, really culminating. And it's been an incredible experience. And what we've learned, again, not just from family members, but from healthcare facilities doing this improvement work day by day, we'd like to hear your stories now, if any of you would like to share. And I see, a handful of participants who've stayed with us, and we'd like to turn it over to you if there's any of your experiences that you'd share. I'm sorry.
Especially what ideas that might have been sparked from our speakers today.
And I think that's in light of what tools are available. How are you handling the issue of communication with family and care partners? How is your patient family advisory council being utilized as really subject matter experts in what it's like to be part of your hospital from probably the receiving end? So, any thoughts? And my guess is you're all on mute to be polite. To be polite, and we'll give you a moment to unmute your lines. I know
Does any of you folks on the line? I assume that many of you probably have the whiteboards now in your rooms. I'm just curious if anybody has an experience in their own hospital where they've involved patients and families in the feedback process as sort of sounding boards about is the whiteboard designed in a way that meets the needs of the family, and is it designed and is it used in a way that lives up to the expectation that it's a great communication device?
Kim and Rita here from San Antonio.
Hi, guys.
Hi there.
Hi. Hey, we just are in the process of opening a whole new tower. So in our original hospital, we had smaller whiteboards that had the RN, CNA, doctor's name, room number, and plan of care, and that was it. So in the new tower, what they've done is developed it even further, and the whiteboard's probably 4 times
bigger.
Yeah, 4 to 6 times the size of the old boards, with a lot more information and a lot more room to write, and that's basically come out of both comments from the nurses and family members, where the patients are laying in the bed and they can't read the smaller board and stuff like that. So we're kind of going to that next step and seeing if that will help communication.
One of the things, this is Karen from the PFAC at Tahoe Forest. One of the things the whiteboards have too is an area for notes for families and or patients to write down things that they want to ask so that they can communicate or not forget. You know, you're like, oh, I wonder when I'm going to get that next lab work. So you can write it down. That's been super helpful too. That the families can write down questions so that nobody forgets, and every family member that comes in knows what questions are wanting to be asked or wanting to be answered.
Mm-hmm.
Yeah.
Great.
Rita's just confirming that on our new boards that we have added that section, so that's
yay.
here that was something you guys did as well.
Right. And the other thing which we did, you know, we have a condition H, like wherever if a family member or a patient thinks that they need help and they have not been heard or their questions have not been answered, so they get a little conversation at the time of the admission. But, you know, again, so much gets said and done and forgotten. So what we did, we have that already typed and printed on there, that if you have an emergency or so, a family member to be able to pick up the phone and dial that number.
Oh, that's great.
That's excellent.
I like that. I like that a lot. It may be a safe way to bring up subjects that someone might be a little reluctant to say out loud, or they may feel that they'll offend somebody, but if it's there as an objective question or concern, there's a little safety there. And then, you know, there's often, particularly when there are a number of care partners, there's often a, you know, kind of a dominant family member or representative of the care partner team, and yet others have questions and concerns as well. And the dominant or in charge one may not always be there, might need that cup of coffee or, you know, an afternoon off of rest. So, again, that's a continuity issue. I think it's a really creative idea. That's great.
And you guys from San Antonio, I think, are demonstrating that you can, what's really important is to listen to your families and patients. And you can do that in a number of ways. Karen from Tahoe has talked about how beautifully involved their patient family advisor council has been in the process, but sounds like you have also collected input from the families, and they're, you know, you don't have to be stuck in one way only thinking, as long as the culture is such that patient and family have a voice.
And I think what you say about the culture is actually what we've been thinking, is we're really kind of in the role of changing the culture and giving, you know, which this whole program has been about, giving people permission to ask questions and feel comfortable, you know, talking to nurses and doctors.
Mm-hmm.
You know, patients and their families, this is Karen from Tahoe, we really are a valuable resource. And at our hospital, what's been amazing, what I've been surprised by as being a part of the patient family advocacy group, is just how open everybody has been to our input about all kinds of different things, not just inpatient care, but the clinics and the doctor's offices and everything. Everybody wants that other perspective. That's been the thing that's been the most surprising to me, is because, you know, as the daughter of somebody who was in and out of the hospital, I always felt like I was a separate entity from the process that was happening around us. And what's happening at our hospital is there's just this open, everybody's got open arms, and they're nodding their heads and going, yeah, we didn't think about that. Because the doctors and the nurses, you guys are in it every day and day in and day out, and you're just trying to get your job done, where the patients and the families have this whole different perspective that they can just wrap around you and help just make it just more comprehensive and just better quality care and better communicative, and then everybody's happy. And that's been the thing that's been so great about watching the culture of our hospital evolve and change with the addition of the Patient Family Advocacy Council, and just hearing what patients and families want and need, and our hospital is doing its best, given the fact that it's still a hospital and it's still a business, doing its best to answer that for our community.
That's great. I think we're acknowledging we're on a journey, and it's a journey to
Indeed.
Improvement. And I just love the spirit of willingness and desire to do better and keep adding improvements to our care settings. So, Horace, I think we're going to go on to our next slide and start to wrap up because we're 5 minutes left.
Sounds good. And I'll just add that I'm reminded of Lisa's comments and Catherine's to some extent about the parallel universes, so to speak, and how it's so wonderful to have patients and families that are empowered through any means. But there's a special power, I think, and a special opportunity for us. We're still not there to have the hospital system, the healthcare system, the providers actually have as much empathy and as much ability to put themselves in the shoes of the families and patients regularly, consistently, deeply, so that they can actually invite and legitimize the use of those tools like the Safe and Sound books and things like that. There's power in patient like you, Catherine, having it from other sources, but there would be probably even greater power for, if the hospital actually wrapped its care around the process of offering it to you as a tool to partner with them in the whole care.
Mm-hmm. So the slide that you see now is an expression of gratitude that Karen and I always share at the end of any of our opportunities to speak with care partners, and all of our facility participants are care partners in this journey. So we do want to reemphasize our gratitude for that. Karen, you want to speak to the LinkedIn?
Yes, we have a LinkedIn group to share family engagement practices under which we're doing with QSIN, which is Quality and Safety Education for Nurses. So we have been collaborating with QSIN for a number of years, and all of our the practices that we are so passionate about fall completely in line with the guidelines for quality and safety education for nurses. So we call them our Safe and Sound QSIN Practice Leaders Group on LinkedIn. And please join us there. We try to share, as I said, we try to share updates and best practices on family engagement.
Great. So,
and our wrap-up is just to remind you that the webinar survey link, it's important for us to get your feedback. So on top, if you can click on the SurveyMonkey, it will take you two minutes or less to fill out the survey and give us feedback. Tomorrow, we are excited to see some of you guys and others in spirit at the capstone event for the whole Engage program. I wanted to also mention that some of the things that we talked about in the webinar today, like the Safe and Sound tools that I think have gotten a lot of attention and the wonderful endorsements, a lot of that is available in the e-guide on our website, and that's on the member portal. So if anybody has any trouble getting to that, just let me know and I will help you. And with that, I want to thank all of you for taking the time out of your busy day to join us today, and I would like to thank Mary and Karen, our consistent and wonderful faculty people. And I especially want to thank our guests, Lisa, Catherine, and Karen, for sharing their stories and experiences as engaged care partners. And talk to you soon. And thank you again all for attending. Have a great day.
Thank you all.
Thank you.
Thank you.
Bye.
Bye.
Bye-bye.